Good morning, everybody. Dr. Dave, Psychiatry here. Thanks for coming to the YouTube channel today. Talking about an important topic, which I get asked about it in the office quite a few times, probably 2 or 3 times a month I get asked this question. Someone says something like, Doc, I think I've got dementia, or I'm losing my memory, I'm scared, or one of my family members was diagnosed with dementia, I think I've got it too. So as a psychiatrist, I often get called to address these type of questions. Start off by saying I'm not a neurologist. So technically speaking, a neurologist would be the expert in dementia and memory loss. Again, if I haven't talked about it in videos that you've seen before, I'm basically a software guy. So brain chemistry, I can sort of consider to be the software side. Whereas the hardware side, your brain cells, how they're put together, how they're connected, and damage to the brain cells that happen with things like stroke or accident or head injury, those areas are typically cared for by neurologists, which is a different specialty than psychiatry. Nevertheless, people come to me asking these questions a lot. So today I thought I would just go ahead and go through how I address the problem or the issue when someone says to me, hey, doc, I think I'm losing my memory. So I'm going to conduct the version of the mini mental status examination that I was taught back when I was a resident in training back in the late 80s. The actual mini mental status exam, I believe, was invented in the mid-70s. Today, you can go on the internet and search mini mental status exam, and you can read all sorts of things and all sorts of the original sightings. But honestly, as I was taught this when I worked in a dementia clinic as a resident in psychiatry, I was taught the method by my mentor, Dr. Pierre Terria, who I'm privileged to have ever met and never worked with. He's an amazing physician and wonderful human being. So this was the version that he taught me. It includes some of the elements of the mini mental status examination, also some of the elements not that are typically in the mid-70s original version of the mini mental status exam. But I'm going to go through that, and if this is an issue for you that you're concerned about, actually, one of the hesitations I had with making this video was the idea that somehow it would give away the answers, and that somebody who had a dementia problem might not, they might be able to figure out how to pass the test. Well, the truth is, if you have a memory problem, you're not going to be able to memorize anything. So that really, that finally, I came to the conclusion that it really was the best thing to go ahead and talk about this, to really just sort of demonstrate in real time what a physician like me, what a psychiatrist like me would do in evaluating the question of, hey, doc, I think I'm losing my memory. What do you think? So basically, I'm going to go through the questions. And then once I go through the questions, I'm going to go back and give the 3 scenarios, the answers that I typically get. And I've got some notes here, so you'll see me referring to the notes. So first off, I will say, okay, here we are. You asked me the question, doc, I think I've got a problem with my memory. What do you think? So it starts off with, I'd like you to remember 3 things for me. Those 3 things are red rose, yellow pencil, and pink Cadillac. So I'd like you to say those back for me. Okay, since you couldn't say them exactly back for me in the exact fashion, I'm going to ask you once again, red rose, yellow pencil, and pink Cadillac. Okay, got those? Okay, I'm going to ask you those at the end of this, so be sure to lock those in. Remember those for me, okay? Got them? Okay, great. Now tell me your name. What's your first name? What's your last name? What day is this? What's the date? Can you give me the exact date today? What's the season? The 4 seasons. Can you just tell me what season it is? Who am I? What time is it? What part of the day is it? Who's the president? Who was the president before him? How about before him? What happened at Pearl Harbor? What happened to the Space Shuttle Challenger? What happened to John Kennedy? Okay, now I'm going to ask you to do some simple math. I want you to start with 100 and subtract 3. What's that answer? Okay, can you take 3 away from that? And just keep going. Take the result, take away 3. Keep that result, take away 3. Okay, now I'd like you to draw me a clock, and not a digital clock. I'd like a round clock face. I'll give you a piece of paper and a pencil. I'd like you to draw a clock face, and I would like to say 20 minutes after 4. Okay, now I'd like you to name all the animals that you can name for me in 60 seconds. Ready, go. Okay, what were the 3 items that I asked you to remember? Okay, that concludes it. That's how I conduct the test. Now, obviously, that went pretty fast because there was no time for answers. And when I give the ask for the animals, 60 seconds, and I ask them to do the entire 60 seconds, no matter how many they can or cannot answer. I try to get 60 seconds. So here's typically how the results shake out. First of all, I will talk about the people that don't have any threat of dementia, in my opinion, whatsoever. In fact, the people that screen normally. So if you want to go ahead and pause the video, go back and take the test, pause now, because now we're going to come back and I'm going to basically give the answers. Okay? All right. So first of all, people that don't have a problem with their memory. If I say red rose, yellow pencil, pink Cadillac, they get those. I say red rose, yellow pencil, pink Cadillac, and they say, okay, red rose, yellow pencil, pink Cadillac. They got it first time. They give me their name accurately. They give me our location accurately. They give the date accurately. They give the time, typically very accurately, because they're in my office at a certain time. They know who I am. They know my name. They typically know the president and the president before him. Sometimes that's funny because if you over the years, you either like the president or you don't. So everyone who asks, sometimes you get a big eye roll when you ask about the president, but it's just an easy one for people to remember. So that's really one that I was taught to use. What happened at Pearl Harbor? People that are over the age of 60, typically they get that one. That's not hard at all. What happened to John F. Kennedy? That's another one that's a little geared more toward an older person. And if you're talking to somebody who's younger than 50, they might not remember John F. Kennedy's assassination. But most people that we ask those historical questions, Pearl Harbor, what happened at Pearl Harbor? Well, the Japanese bombed us, and that was the start of World War II. Or we got bombed by Japan. That would be a typical answer. What happened to John F. Kennedy? He was shot. Okay, do you know where he was shot? He was in Dallas, right? Do you remember the name of the man who shot him? Many people will get Lee Harvey Oswald, or they will say something like, well, it's not really clear, but because some people still not really sure if they're convinced that that's what happened. At any rate, they'll remember the details. Space Shuttle Challenger, typically the answer is it blew up. So that's typically the answer. Now the serial threes, that's taking 100 and subtracting 3. You can do a harder version of sevens, and I think honestly 3s and 7s. It's harder for me to. It's my test. It's harder for me to do 7s accurately. So I give people a little bit of a break and I ask them to do 3. So that's going to be 100, 97, 94, 91. 91, 88, 85, 81, 78. I think that's it. So if you get a series of, 5, 6, 7 math problems that you have to hold that number in your brain, which is why it's a memory function. You have to hold that number and then subtract another number from it. So that's typically people that have no cognitive impairment. That's easy. The clock, a person who is able to draw without cognitive or impairment or dementia will typically draw a round face. They'll draw the numbers, a 12, a 3, a 6, a 9, and the hands get close to each other with a long hand and a short hand, and they're both pointing toward the 4. So I'm not going to draw that for you, but that's typically what you would get, an accurate one. How How many animals can you name in 60 seconds? That goes by various names. I was taught that it was called the Boston naming test. It turns out if you research it, there's some variety in how this is called, but it's a variation of the Boston naming test, and it's a very good test for cognitive capacity. And so a typical person that doesn't have any memory problems will start off with cat, dog, horse, cow, pig, chicken, duck, rooster, monkey, elephant, rhinoceros, snake, aardvark, shark, flounder, trout, dolphin, octopus, katydid. I don't know how many I just got there. But in 60 seconds, a good answer, a passing answer is at least 15. And the style of answer is important because people typically, when they're answering the Boston naming test, their brain has to be in a place. So typically people start with cats and dogs because those are what we have in our homes. So there's going to be cat, dog. I didn't mention birds, I don't think too much, but typically it's cats and dogs. And then around here, people, they start with the farm typically. And so I named some farm animals, and then I named some jungle animals, and I think I got into maybe the snake was in the jungle, and that sort of led me to the fish idea. I'm not sure I said anything about birds in my answers because I didn't write it down. But basically the flexibility of being able to go to different parts of your mental mind of what animals are, that's the essence of the Boston naming test. So in 60 seconds, anything over 15 is great. Anything over 15 is great. And then after the Boston naming test, once they've done all that, typically that's 5 to 7 minutes, it's in that zone, I will ask them, hey, what were the 3 things I asked you to remember? Red rose, yellow pencil, and pink Cadillac. If they get those, obviously they don't have any cognitive impairment. So the question would be, why would somebody think that were losing their memory if they pass the mini mental status exam with flying colors, and I say, well, you don't have any cognitive impairment at all. Why would they have the idea that somehow they were losing their memory? And in my opinion, really, it's that we live in a world today where every handheld phone is a computer. We are so far beyond the days of a dial-up telephone and 3 channels on your television. We live in a world that is so noisy and so many things going on, and we have so much multitasking that the average human has to do just to live a normal life, that I think we just simply get the idea that we're losing our memory because we reach a point where our central computer, our brain, cannot process all the stuff that's being asked to process. And I'll tell you, typically it happens something like this, that somebody's thinking about something else and they do something and really think about it, and then one moment, 5 minutes later, say, where's my pen? Where did I put my pen? I can't find my pen. Well, I'm losing my memory. Where's my pen? Oh, it's here. Okay, I found my pen. Well, what happened was I was thinking about something else, and I put my pen over here, and I didn't put that into memory. It's not in my memory to put it. So the idea that you are losing your memory is really more accurately if you have this problem of, you did fine on the test I just gave you, but you still have the idea that you're losing your memory. Well, you're not. You're basically not putting things into memory. So the act of memory is taking an item, putting it into storage, and then pulling that back out of storage. That's remembering something. If you don't put that idea into memory, so I didn't say I'm putting my pen on the right side of my desk right now, I'm putting my Sharpie over here. If I didn't put that in my memory, I don't have a memory problem by not being able to take it out. It was never in memory in the first place. So this is a problem with information processing or information overload, which I think is very common in, basically people walking around today. And certainly if you have depression, if you have anxiety, if you're overthinking and can't shut your mind off, well, your ability and your desire and motivation to put things into memory is lower than it should be. So sometimes the people depressed, people that are profoundly depressed, and they say, well, I can't remember anything. Well, they're just not making the effort to put things into memory. They're so shut down and so depressed with their brain chemistry problem that they're not putting things into memory. So the essential point there is that if I say, here is my Sharpie pen, I'm putting it on my desk, and it's whatever day and time it is, then that's in my memory. Now, if I can't remember that in 5 minutes, if I say to myself, my pen's right there, and I can't remember that, then I have a problem. But people that do well on the mini mental status exam form that I do, typically that's not the issue at all. Typically the issue with them is that they can't shut their mind off. They're thinking about other stuff. They have a lot on their mind, and they simply don't put certain facts in their memories. And that leads to, where's my car keys? Where did I set my cell phone? Those type of events. And that's not memory loss. That's failure to put stuff into memory. Okay, now the second category, which maybe I'll just go to the third category, because the third category is people who fail, and then we'll talk about the gray zone in between. So the third category, people who fail. The first thing to know about people that the question is, what's their memory and how is their memory, is that they typically don't start with that question at all. People that have struggles with their memory and really know that they can't remember things, the first thing they do is hide it. So loved ones start to see evidence, or friends start to see evidence of lack of cognitive ability and lack of memory, cognitive decline, we call it. And the individual that's struggling oftentimes will deny it, push it away, not deal with it, won't talk about it, wants nothing to do with the concept. So when I have a family member that brings me a patient and I say, hey, listen, your wife says that you might have some memory problems, and the patient might say, sure, she says that, but I don't think it's a big deal. Well, then I go ahead and see if I can convince them, in this example, to agree with me to take the test. The first thing when I say, well, okay, I'm going to ask you to remember 3 things, the response is typically, well, why do we need to do that? So I explain, well, that's what the test is. That's what I was asked to do. You said it was okay to try. So you start off with, just see if you can remember for me, red rose, yellow pencil, pink Cadillac. Can you just say those back? Red rose, yellow pencil, pink Cadillac. A person with really bad cognitive function won't even really be able to register those. So that's called registration. So that's getting something into memory. They can't even do that part. That's significant for cognitive decline. And again, in the interview, it typically sounds like something like, well, something, you said something, but that's not really important. I don't really need to remember that. That's what you get with someone who has severe cognitive decline. Or perhaps they'll say something along the lines of, yeah, it's a pencil something, but this is silly, doc. Why are we doing this? So it's a struggle right out of the gate to get someone to remember the 3 items. Next question is, tell me your name. That's typically very easy for someone who even has dementia. They'll tell you their name. Location, a lot of times they might get the location right, but they might not at all. And the date and time, that's often met with a good attempt, a sincere attempt. That's a really sensitive one, because a lot of people, they'll say a 2008. They'll just give the year. Well, if it's 2024, that's wrong. But a lot of times people will take a confident guess at the year and get it wrong. And obviously what we're looking for is somebody who just can give us the date. And then the location, where are we? Many people, again, throughout this process, it'll be peppered with, well, why are you asking me this, doctor? This isn't that important. Why are you asking me? When I'm interviewing somebody, I got to keep them motivated. And one of the things that happens is they get discouraged, and you have to try to motivate them to get through the entire test. So I try to be as encouraging as I can. But again, if somebody's severely cognitively impaired, the next question, who's the president? They might or might not know. Who was the president before him? Typically, that's answered with sort of a shrug. What happened at Pearl Harbor? Despite having serious mental decline, a lot of people will keep their long-term memory from their core years. And even people who have severe cognitive decline and cognitive impairment, cognitive being the ability to think, I keep using that word, they will remember remote events like Pearl Harbor, the Japanese bombed us, the John F. Kennedy, he was shot. It's not uncommon for people to be able to pull that out, although people that have more serious cognitive decline won't be able to do that. Serial threes, virtually impossible for people that have severe cognitive decline, and often is met with, "I was never good at math." That's what they'll say. I'm not good at math, doc." So they blow that one off with that excuse. The clock, many people with severe cognitive decline can't draw the circle even of the clock. They'll draw a semicircle or a crescent moon, or they'll draw a circle and the numbers they'll put 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12 in the first quarter, or something that is an attempt to draw a clock. And that's one where if you can just get them to have a piece of paper and a pencil, but if they can't draw the clock face at all, they're not going to be able to give you 20 minutes after 4 in a clock. The Boston Naming Test, again, very good test for cognitive capability. This is what the Boston Naming Test sounds like with someone who has severe cognitive impairment. Because they'll start and they'll say, cat, dog. Okay, why are we doing this, doc? Okay, well, I'm doing the test. So yeah, you got 50 more seconds. Just keep going. You did great so far. You got cat and dog. And they'll pause and they'll say, okay, well, there's dogs and cats. Oh, doc, this is silly. Okay, you've got 30 more seconds. Just keep going as many as you can get. Dog, cat. That's about what I've got. Okay. All right, fine. You got 2. That's great. You got 2. And since we didn't get the first 3 items registered, I will ask, did you remember anything about the first 3 things that I asked you? And the answer is typically, no, that we were just getting warmed up. I didn't get that. So obviously a person that, number 1, doesn't want to take the test. And number 2, when they take the test, deflects the answers because basically they're trying to hide the fact that they're not able to process information and to remember things and perform cognitively. That's the hallmark of somebody who really, really does have a problem that needs to be evaluated by a neurologist. And I would certainly say to the loved one, yes, I would like you to go to the neurologist and talk about anything that they can do for the possibility of dementia, if it's early onset, Alzheimer's disease, things of that have various names that some probably more detail than I want to give you. But the point is that the neurologist, that's someone who I want to see the neurologist right away. In today's world, sometimes that doesn't happen right away. But this is a really, really difficult situation because now the loved ones have strong positive evidence that whoever this is, whether it's husband, wife, grandpa, uncle, aunt, whoever it is, sister, needs to be protected because if they can't answer these questions in this way, they're likely not safe to live at home alone, certainly not safe to drive. And that's an issue that, people with dementia, that's one of the hardest things, the 2 hardest things that they deal with is they don't want to give up their car keys and they don't want to be placed in a facility. The good news about that is when that happens and people lose their ability to drive and their place of facility, because they don't remember things, they typically don't stay angry very long. Families that deal with this are often very frightened about saying, okay, listen, you're not safe to drive anymore. I'm taking the car keys away, or we're moving you someplace outside of your home. And yes, there's a lot of emotion around that the families bring and the friends bring to that discussion and that problem. But the truth is, once they stop driving the next day, they literally don't remember. They don't remember that they're not driving because they don't have good memory. And so in the most severe cases of dementia, that's actually turns out to be much easier than people expect. And once they're moved to a new facility and they acclimatize to that new situation in 3 or 4 days, a week, whatever, oftentimes they're simply just change modes and the anger and frustration about losing their driving or having to move just goes away because they don't remember that it happened. The hardest group of these is the middle ground. Now, I don't deal with these because psychiatrists, again, I'm going to refer these people to neurology. But you can imagine that if someone struggles between the scenario of I'm perfect in the test versus I can't do the test, well, how do we deal with people that say, okay, can you remember red rose, yellow pencil, pink Cadillac? Some people start off with, well, say it again. Red rose, yellow pencil, pink Cadillac. Okay, red rose, yellow something. I don't remember the third one. Can you tell me? Okay, so that's clearly in the middle of success versus failure of that test. So that raises the flag. Patient's name, that's typically easy for people. The date, the location, you can imagine that if there's a hit and miss, if there's, I know I'm in the doctor's office, but I can't remember exactly what town we're in. I think we might be such and such place, but I'm not really sure. So that's a gray zone that people have to that I have to face and say, okay, how much is that they weren't paying attention to, how much that they don't remember? Who am I? They should know my name, although if somebody made the appointment for them, maybe they would not. Who's the president? That's people that are in the mid-range. Typically, they don't struggle with the president. They might struggle with who was the president before him and before him or her, whatever, historically when this goes down. But the issue of who is the president is something that ought to be fairly easy, but some people have a hard time remembering who it was 8 years ago, which, it's 8 years. Pearl Harbor, depending on your age, JFK, depending on your age, Space Shuttle Challenger. If they don't remember anything about those, that's certainly a red flag. Serial threes is hard, depending on their background. I think that's one of the hardest. I joked it's the hardest one for me. But people that, if you're dealing with a farmer or somebody who didn't, never went to school, because I have patients like that lived on a farm and they literally never went to high school. They, can't write and can't do math. That happens sometimes. You have to assess who you're dealing with. But if you've got a person who's an accountant or deals with numbers all day long and can't do serial threes, 197, 94, 91, that ought to be fairly easy. But there are people sometimes that struggle with that. The clock, between complete success and complete failure, you will see a round clock face. Maybe the numbers are not exactly right or exactly spaced, or they'll get the numbers. They'll put 4 cardinal numbers, 12, 3, 6, 9, but they'll struggle with where to put the hands. So sometimes they'll just struggle with that a little bit. So again, the middle ground. The Boston naming test, that's a really good one, again, because people that, just are mentally very, very solid, they'll start off and they'll say dog, cat, and they'll do barnyard, or they'll do zoo. They'll walk around the zoo, or they'll go to Africa, or they'll go to the beach, or they'll talk all about different birds. So that's success. People that get less than 10 on the Boston naming test, I sometimes I worry about them a little bit. So again, you sort of have to use your judgment. The 3 items at the end, they ought to be able to at least remember the typical mid-range. I'm a little concerned about person would say something like, there was something that you write with, but I'm not. I think it was a pencil, but I don't remember. Was it a pink pencil? Was it a red pencil? Not really sure. The second one was a flower of some kind. Can't exactly remember. And the other one was a car. So those type of answers are in the middle. Clearly not success and clearly not favor. Again, the ones that you get to see the neurologist are the two latter groups. The one that clearly has cognitive decline and clearly needs help and protection right away. And then the middle folks. But the people that pass the Boston naming test and pass all the other tests that I gave, the first category, the people that do well with all of the questions, that say, hey, I'm losing my memory. Again, those people are typically the ones that they're overloaded with information. So they're just simply not putting stuff into memory. It's not that they have no memory. It's that they're not putting things into memory. And when things are important to them, they remember that. So for example, my car is out there because when I came to the office, that's where I had to put my car. And if I go to the parking lot or the airport or something, guess what I do? I take a picture of where, because I'm going to go on that trip and I'm going to come back and not remember where I parked it. So that's the question is how much cognitive decline do I currently suffer because I do that? And honestly, I don't believe I have any right now. But I think it's an important thing for people that have that question, that don't have any type of true cognitive decline, understand what it means to not have good memory, that they're simply not putting things into memory so they can't get the stuff out. That's simple. So that's my coverage today of the mini mental status exam, my version of it, the question of hey doc, do I have dementia? Am I losing my memory? I hope that's helpful to you. I hope it's helpful if you're dealing with someone that you care about in your circle that's dealing with this. And I encourage you to, if you have questions about it, speak to the doctor that's taking care of you, because really any doctor in any specialty should be able to at least steer you in the right direction of what to do about memory, especially family practice, internal medicine. They should be able to steer you in the right direction about what to do if you have dementia or a problem with a bona fide memory loss. So that's all for today. I'm Dr. Dave Psychiatry. Thanks for coming to see me.